Okay, Dr. Joseph.
Okay. So thank you, Faisal ji. Good evening, all. I am Dr. Joseph, President, IDEA Kerala State. Respected State Secretary, Dr. Deebu, President-elect, Dr. Shibu, our faculties, Dr. Rajiv Jaidevan, Senior Consultant, Gastroenterologist, Sunrise Hospital, Kochi, and Dr. Pawan Madhusudanan, Secretary, IMEC, Trichur, our State CD Chairman, Dr. Faisal CP, our CDA Chairman, Sushant, other office bearers, and dear friends. Now, we are facing one of the worst public health crises now. Our country has been severely affected by unprecedented second wave of coronavirus. A combination of large asymptomatic population and the presence of more infectious variant of virus makes the situation bad. Now, India is the perfect place for this virus. We 1.3 billion people, and the spread is conquering not only in cities, but also in villages and tribal areas also. We salute all the frontline warriors, health professionals, government authorities who fight against this deadly virus. In Kerala, the new Legislative Assembly is ready to pledge, and I would like to congratulate our new leader, Sri Pinarayi Vijayan, and all entire team. I hope the new team will manage the situation efficiently. Now we are struggling amidst the second wave and is severely worried about the third wave. But if we show some strong measures to control the spread of virus, then the third wave will not be happening. In this difficult situation, we can help government by joining hands with the able government team for vaccination or other voluntary help by COVID brigade or anything. After the first wave of corona, we made a structural and behavioral change in our clinical practice. Now we are facing a global health crisis. Coronavirus is abundantly present in the nasopharyngeal and salivary secretions of the affected patients. So, we dental healthcare professionals should provide dental treatments intelligently, but at the same time, preventing the spread of infections also. We have published a COVID guidelines, perfect COVID guidelines for the dental treatment last year. So, friends, better to be safe, prudent with the restricted practice now. We are acquiring knowledge through eminent faculties like Dr. Rajiv and Dr. Pawan today. Let me congratulate the CD wing of IDEA Kerala State and all the participants of this webinar for the gracious effort and presence. With all your permission, I would like to inaugurate the CD program, the changing perspective and insights to the role of dental surgeons by Dr. Rajiv Jaidevan and Dr. Pawan Madhusudanan. So let us stay safe and stay inspired with the most relevant topic. Thank you. Jai Hind, Jai IDEA.
Very good evening to all of you. We have two speakers for the day. First speaker for the day is Dr. Rajiv Jaidevan. And it's a privilege to introduce Dr. Rajiv Jaidevan, who completed his MBBS and MD in General Medicine with top honors from Christian Medical College, Vellore in 1995. He received training in clinical epidemiology and basic health from Erasmus University, Rotterdam. And he has been extensively performing endoscopies, and he has done around 19,000 endoscopies till date. He was awarded MRCP from England in 1996, and he obtained board certification in medicine and gastroenterology from New York Medical College. He has spent 3 years in UK and 10 years in US before returning to his hometown, Kochi. He established the Department of Gastroenterology at Sunrise Hospital, Kochi, and he's heading the department. And we are happy to have him here for the CD program. And I welcome Dr. Rajiv Jaidevan for giving us keynote lecture. Over to you, Doctor.
Thank you, Dr. Faisal, and thank you, Dr. Deebu, and others for the invitation. And thank you, Pavan, for being here. And thank you to all my friends um, for attending this program. So I'll be speaking for about 15-20 minutes, and then we will have a 10 to 15 minute question answer session. If we can have questions of common interest, that will benefit everybody. So as we know, we are in 2021 now, and we are in a different situation compared to last year in many ways. So the situation now has been different in many positive aspects. See, there are many positive aspects that we fail to remember about this year. See, when the pandemic struck us last year, there was a lot of uncertainty. We had very little idea what this was going to do to India. We are a very densely populous nation, and as to how the country will be affected, how many people will be affected, how many people will die from it, and how long it will stay in the country. So that uncertainty has been erased to some extent. We know that it lasted for a few months, give or take a few weeks here and there, and it swept across the country like a wave. Some parts like Maharashtra were severely affected. Kerala also was affected, but Kerala did a lot of work in terms of preventing and awareness building, and we were way ahead of the rest of the country in terms of awareness building and information gathering and dissemination. So our media really hats off to them for standing with the medical fraternity for dissemination of information. So Kerala did well. With a very, very good public health system, Kerala did very well last year. But we know that this pandemic is not like a one-way. It's not like a one-way epidemic. It just comes and goes. So we know that different nations have had different waveforms. So the first point is that now we know, at least we know that this pandemic, this is the way it behaves. The last year we did not know which way it's going to be. So this year, at least we know what to expect. So everybody knows. The doctors who were studying the pandemic knew ahead of time, but the general public are only realizing now that this is not, that India is not an exception and Indians are not immune to the pandemic. All kinds of nonsense was circulating around last year saying we beat the pandemic and it's only a Western disease and so on. So all that's wrong. It affects everybody, the whole world equally. So that is it brings a sense of closure. Closure is the term I use, that everybody is understanding now that there's a problem. So that's I call that development. See, unless you know a disease, how will you fight it? If you don't have the proper information about a disease, or if you're unwilling to accept the proper information about a disease, how will you fight it? So this is very good in one sense. At least we know this year in 2021 we know what the pandemic is like, and we know it's not going away. We know we will get future waves. There's no doubt about that. All right. So that is one. Second is the second thing is that when the pandemic hit us last year, we did not know how to treat it. See, different people were trying different things, and that individual observations matter very little. When it comes to diseases like this, new diseases, individual um, experiences. As I was talking yesterday at my CMC Vellore talk, it's like a dog barking after a train. The dog may think the train is moving because the dog is barking. The dog may be convinced that the train is moving because the dog is barking, but the train is moving because of a different reason. The dog's barking has nothing to do with it. Same way, many people came up with all kinds of observations saying if you do this, then the pandemic will not happen. You can kill the virus, etc. So all that was complete nonsense. So all that nonsense has been filtered out this year. At least we know from large randomized controlled trials that have been painstakingly done. We know what works and we know what does not work. See, in medicine, it's very important to know what works and what does not work. Both are equally important. And science is not an area where you can have, in my opinion, it works. In my experience, it works. It's completely not acceptable, because science has to stand together based on data and proof. We can't have one person suddenly say, oh, in my experience, this is the way it's going to work. No, it does not work like that. So The sooner we accept that, the better the outcome is. We know that steroids work, but only when used in the right time, in the right patient. So in other words, you're already seeing reports of steroids being overused in people who don't need it. And in fact, it'll kill people if you use it in the wrong patient. So we know what works. We know how exactly to use oxygen. There are different ways of using oxygen. We know we've come to realize that there is something very simple that can be used, which is called proning. Proning is the process of, as all of you know, I'll just reiterate it. Instead of lying supine or on the side, if you have the patient prone, the oxygenation magically improves. So that is one of the biggest scientific developments that occurred in the pandemic. So we also know that we want to keep the patients away from a ventilator to the extent possible. All right. So without going into the gory details, the trend in medical care, in critical care, is to give alternative methods of oxygen delivery to the lungs just to keep the oxygen going and wait for the body to recover. All right. So we know that. Earlier, when the pandemic hit, everybody was being put on a ventilator because we were acting based on old guidelines, based on old diseases. This is a new disease. So the threshold for using a ventilator has changed. So that's the point I'm trying to make. We also know, most importantly, that we, as the world of science, we came up with something called vaccines. So you might have seen some of my write-ups on vaccines. I was one of the first to actually write about vaccines. And obviously, when you're the first to write about something, you face a lot of brickbats. Everybody will throw stones at you, saying that you're wrong, you're crazy, you're this, you're that. But the point is, if you follow science, you will never be wrong if you follow science. So I remember writing about vaccines last year, and but it's thanks to a lot of us, including Pawan and yourself and good doctors, that our society in general in Kerala have been accepting to vaccines. And now look at us. See, in Kerala, a large number of people have been vaccinated compared to most states. We have very low vaccine hesitancy. And if you talk with the people who are on the grassroots level in the ICUs treating patients, there's nobody who's been fully vaccinated in the ICU. They don't even come to hospital. They may test positive, but they're not getting sick. Well, I'm talking across the board. There may be one or two exceptions here and there that I don't know about, but this is a universal observation by many doctors who I network with. I spend a lot of time networking because that's one way I'm able to get proper information. So all my colleagues tell me, look, we are not seeing people who are vaccinated coming in sick. So that is proof, absolute proof that vaccines work. So these are some of the positive developments that have occurred. And we also know that even though I had personally written about it, my article came out last April 10th. I was one of the first to write about how the virus actually spreads in a room. Virus is an indoor virus. It is not an outdoor virus. When I'm sitting here talking, I'm producing aerosols. And aerosols, like cigarette smoke, they circulate in the room. And right now, it's raining outside. All my doors and windows are closed. So this aerosol is going to stay in my room for hours, and whoever walks into my room will breathe the same aerosol that I breathed out. And most of it's generated in the vocal cords. So just like a deodorant spray that stays in the room, or cigarette smoke that stays in the room, virus stays in the room in the droplets. So we know that if you open the windows, or if you put an exhaust fan, or if you have cross ventilation, open two doors and let air flow, the chance of getting infected is much lower. And we all adapted in our practices accordingly. We had doctors start clinics in their car shed. All right. So, again, when somebody did that, they said he was crazy, but he was right. He started his clinic in his car shed because it's well ventilated. So we've all made adjustments. So these are some of the positive developments. And the way forward, I think that if anyone has not been vaccinated, they ought to get vaccinated. And also remember that vaccination is not 100% guarantee against anything. It will protect you to a large extent from virus infection, and it will protect you to a very, 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 very high degree against severe disease. But remember, percentages can be deceptive. See, the general public thinks that why do general public think it's a COVID-19 is not a serious disease? They say 99% get better, 99% don't die, but 1% die or 2% die. For them who are numerically challenged, 2% is nothing. But have you calculated 2% of the population? That's huge. That's lakhs and lakhs of people. So the same way, when we talk about the efficacy of vaccines, we talk about high percentage, high 90s. But remember, if the efficacy against severe disease is 97%, there is still 3% who are outside the 97%. So it's always good to take extra precautions, be very careful, pay a lot of attention to the air circulation in the room. The more open the setting, wherever we practice or wherever we meet people, the better it is. And so those are some of the things. And then we also come across discussions about variants. We know that variants are coming out, and we knew they would come because the first variant that came out was D614G that came out, I think, in April last year. I'd written about it at that time. It was not a big concern, but eventually D614G replaced the old strain. And now we have newer ones coming out. In our discussion, maybe during question time, I'll elaborate a little bit on variants, but I'll put it in very simple terms. Right now, really, there is the amount of alarm that's caused by news media is not warranted. There's really no harm. They're not they're not dangerous viruses. They behave exactly the same way. They may spread a little bit faster, but then spreading I would say spreading 90% is human behavior, and only 10% can be attributed to the virus. If you're careless, if society is careless, the virus spreads. Whether it's old model or new model, it doesn't matter. So there is a tendency for governments and for people to blame the virus. It's all the virus's fault. But ultimately, the amount of amplification that any country does, it's the country's fault or the people's fault, unfortunately. So while we blame the virus for the variant, we must always remember to blame ourselves as well, because in Kerala and in India, for the last 6 months, people are behaving completely irresponsibly. This includes doctors as well. They were behaving as though there's no pandemic, and people who spoke that, be careful, we were all ridiculed. But that's how society is. So let's move on. Let's pick up from where we left and let's move on. So I've covered in very simple terms, I've covered what vaccines do for us, what they don't do for us, how knowledge has changed, how treatments have changed, why treatments have to be given according to protocol, why individual opinion is absolutely of no value. I'm very sorry, it's of absolutely no value. Individual opinion does not count, because the reason is, as I explained yesterday, the reason is this disease has a very high spontaneous recovery rate. If you try to intervene in a epidemiologically speaking, if you intervene in a condition which has high self-resolution, almost anything you do will seem to work. For example, if you give a patient a glass of hot water, and if all the patients improve, that doesn't mean the glass of hot water was the cause of improvement. If you give them a glass of Bonvita, they'll say, okay, Bonvita seems to work. So anything that you do seems to work. And there are a lot of doctors who claim all kinds of things, that I did this, it seems to cure the virus, and don't believe that. Just go with evidence. There's no dramatic developments here. We have very basic knowledge. One, steroids work in a given subset. Oxygen works if your lungs are compromised. Vaccines work. So these are the three fundamental facts. All of the others are left to the individual treating doctors. There are some medicines that may work in some patients, but not in all. So I'll stop now and I'll invite questions, because I enjoy questions.
Hello, Doctor. Doctor,
I'll
can you hear
just
me?
summarize what is current and what I didn't want to repeat what you already knew. So whatever I thought was important, I've put in my talk.
Doctor, we have got some questions now.
Go ahead.
Yeah. One question is that the doctors are getting some messages from medical doctors groups about taking ivermectin and other drugs like the new drug, DRDO drug. Should we take these medicines if we are in contact with COVID positive patients?
Okay, I will. What I'll do is I'll send you my lecture at CMC Vellore, and all the answers will be there about how to treat the virus, why we believe in certain hoaxes and all that. Ivermectin is a hoax. A hoax is something that many people believe in. When a lot of people believe in the same thing, it becomes a hoax. And once a hoax is started, it's impossible to stop it. The reason why hoaxes happen is because rational thinking is by our frontal lobe, which is basically neocortex. It's a slow, calculated part of our brain which we use to make judgments, and we calculate numbers and all that. Beliefs, on the other hand, like ivermectin and other things, are all handled by our limbic system, which is our involuntary primitive part of the brain. All the beliefs, like, some people believe that you should not look into a cracked mirror. They think it brings bad luck. So every time I look into a cracked mirror, I'm very afraid because it's gone inside my limbic system. So I can't help it. I don't want to look into a cracked mirror. So ivermectin and so many other, the so-called, anecdotal treatments have got into some people's limbic system. And it's impossible to argue. Don't argue with anyone who gives it ivermectin because they'll never believe you. So they believe that, which is why I said belief is one thing and science is something else. So my advice, if you're exposed to COVID-19, there's no shortcut, no need to take any medicine at all. And just be careful. If you watch for symptoms and if you get tested, if there are symptoms, yes, and just go with the protocol. That's pretty much it. In other words, there is no magic remedy. No drug works in this setting. In this particular setting, that is after exposure. Chloroquine was a hoax. I wrote about that in April last year. People laughed at me because the first trial from France was a completely bonkers trial. It was probably the worst medical study ever done in history. And the American president tweeted about it, and then it became, you could not stop chloroquine. Still, there are doctors who believe in chloroquine. So it's a big mess, so we don't want to get into that. So bottom line is, these things don't work. Don't waste your time on it.
Doctor, the next question is why government is saying now antigen test is better than the other tests?
Okay. Antigen test and RT-PCR they do different things. Even though they test for the virus in different ways. PCR test is an amplification test. So even if there's a tiny bit of RNA hanging around, it's like a microscope. So you look at it, even the smallest RNA is suddenly seen, and so it's an amplification test. So even if you're picking the patient up at the tail end of an infection, you will find a positive. And even after the virus leaves the body, after about 10 days, these particles of the virus that hang around in the body sometimes get picked up by this. So you may get a false positive. Antigen test, on the other hand, looks at the body, the proteins that make up the body of the virus. So there's a lot of virus, antigen test becomes positive. And when is there a lot of virus? On day one of symptom. If I pick up the virus today and my symptoms appear 5 days from now, that particular day, I'll produce the maximum amount of virus. I'll produce such high amounts of virus. Anyone who comes into contact with me, I'll give them the virus. So remember, the patient is most dangerous on day one or on the day prior. Day prior, there's no way of finding them out. So day one and day two, if you do an antigen test, there's a high chance of the test becoming positive. But the longer you wait to do the antigen test, the less likely it'll become positive because the viral load actually comes down like this. So for mass screening, antigen test is cheaper, it's easier to do, less paperwork, less manpower needed. So antigen test is, in my opinion, the ideal test. RT-PCR is a confirmatory test used for certain special settings.
Sir, is there any chair-side strip tests for screening?
Screening RT-PCR, this one, antigen test.
Antigen test. Yeah. Well, another question is regarding the dental practice. Is it safe to do dental practice in a closed environment? That is, in a closed room with AC on.
Good question. If you have an AC on, just make sure that you hire an engineer. You consult somebody who knows about ventilation systems and see if the air exchange from the room is adequate. So it's okay to have, the entire Western Hemisphere is full of closed rooms, but they focus on HVAC systems and they focus on how efficiently the inside air is exchanged with the outside air. So hire an expert, consult an expert, have them come and inspect your clinic and see how efficient your air exchange system is. If your air exchange system is not efficient, yes, it puts you at risk for getting an infection.
What is the role of HEPA filters and electron cloud generators in a closed environment?
What's the second one? HEPA filters and
electron cloud generators.
I don't know about either. I'm so sorry. I don't. Then.
Okay.
Any other questions?
Another question is about how different should be the protocol or practice protocol in the second wave. Should we be more careful in the second wave?
All right. See, it's like this. See, last year we got a mild rain. This year,
can we expect a third wave also?
Yeah. Last year we got a mild rain. This year we got like so much rain, it's about to flood. something like that. So last year it was a mild infection, so very few people got infected. This year it is everywhere. It is literally everywhere. So we must be very, very guarded. If we took this much precautions last year, we must take this much precautions this year. Virus is the same, but you don't want to get sick with the virus. So same level of precautions, but as I said, I'll repeat myself, pay attention to how efficiently the air you work with is exchanged with the outside room. So that's the most important thing. Absolutely.
Sir, Dr.
So,
Devu.
should we keep
Yeah.
a fallow time? That is a time. Deepak, I'll finish this question, Dr.
Yeah,
Deepak.
yeah, please. Yeah.
I would like to add to that, just stay away from anything that sounds like a scam. See, this is the time when a lot of people sell a lot of products saying that this will kill the virus, this will eliminate the virus, this light will sterilize the room, etc. You know what? I wouldn't believe a word of that unless it is really endorsed by a major society, someone like CDC or someone like that. Just stay away from anything that sounds too good to be true, because there is really nothing that's too good to be true at this point. But these guys, the way they communicate with you, they can be very pushy, they can be very persuasive. They may come to you with some research papers which are put out in trashy journals. So stay away from anything that sounds very magical. All right.
Is the time frame between two patients, giving more time between two patients, will it help?
It will help. Yeah, as long as that air is exchanged. You need, if you're practicing in a closed room with no air exchange, no amount of gap is going to help you, because aerosols circulate for hours in the same room. So if you don't exchange the room, or if the windows are not open, then the gap will not help. But otherwise, for a well ventilated room, either way, through machine or through windows, definitely a gap is helpful.
Dr. Deepu, please.
Yeah, actually, the question I was coming to ask was answered by Dr. Rajiv. Basically, I was planning to ask about ultraviolet light, and
I know.
yeah, I got the point.
Yeah, we are treading into very, very.
Yeah. Now, another question I would like to ask, sir, is regarding the efficiency of the virus, the efficacy of the vaccine that we've got. So now there are some antibody titer tests. Can you elaborate on those?
Don't waste your money on it. There's no role in checking any antibody titer. Trust me, it is not recommended. I'll tell you why. Why do you do a test? You do a test fundamentally, for any test for that matter, to see if you can either treat the patient differently or know something new than you did before the test. Doing an antibody test will not give you any new information. There are only two outcomes. Either you have antibodies or you don't have antibodies. If you have antibodies, it doesn't tell you your vaccine actually produced them. You may have picked up asymptomatic infection. And the antibodies you test in the lab are not the neutralizing antibodies. Neutralizing antibodies are, if all your antibodies form a 100-member orchestra, neutralizing antibody is the lead singer. So it's very difficult to identify the neutralizing antibody from these conventional tests. And unless you go into a research lab and subject yourself to a viral neutralization test, which is very cumbersome in BSL-3 labs, it's impossible to measure them commercially with very few exceptions. So don't waste your time on it. Suppose it's negative, it doesn't mean that you don't have neutralizing antibodies, because as I said, neutralizing antibodies is so small in quantity that even though some labs claim to measure them, it really does not happen. So don't waste your time on it. Even if your antibody test is negative, you could still have your neutralizing antibodies and your T cells. So you don't have to worry about that. And it's not just me that's saying it, the CDC also saying that. All right. I know people do their test and post it on WhatsApp.
Yeah.
Everybody gets anxious. Don't. Just ignore it. If you
how
ask me,
is
did I check mine? No, I didn't even bother. Okay.
So how is the spread happening now? It's through the surfaces or through the air?
Yeah, surface is not very prominent. It's aerosol. It's aerosol. The smaller the room, the more the number of people, the longer the time spent together, and the more talking that people do with masks down, the spread is more. So it's like that full square that I keep putting out. Small room, more people, more time, more talking. No mask, maximum spread. The opposite of that is less spread. So just keep that in mind.
Okay, doctor, that's all the questions we have for you for time being.
And I'll tell you one last thing. You'll hear a
Yeah.
lot of scary stories, and just think for a moment: why are the scary stories reaching you? Simply because they're scary. Because people only forward scary stories. So don't believe any scary story. If there's anything concerning, you'll hear from me or Pawan or somebody who's holding official post. We will either post it on our Facebook or we'll put a statement out. And trust me, something like that has not happened in a very long time. So don't worry about it. So if you hear anything that is too good to be true, a miraculous cure that Dr. Rajiv or Dr. Pawan doesn't know about, or the whole world doesn't know about, I discovered something, just don't believe them. Don't argue with them either. Don't waste your time arguing with people.
Dr. Debo, you want to add something?
No, it's okay.
Is it okay, Dr. Deepu?
So, yeah. Okay, Debo, on official vote of thanks. Debo.
Dr. Rajiv, before you leave, you've been doing extensive research since the onset of this COVID pandemic. So,
Mute them. Mute them.
So can please mute all the other people, please?
I can't hear you. That's right.
audible now?
Yeah.
Yeah.
So you've been doing extensive research since the onset of this pandemic. So can you please tell the audience how you're updating? I'm sure like all the leading media, they all are following your Twitter handle to get the recent updates about the COVID pandemic, right? So just tell all of us how you're updating, how you're doing this research work, extensive research. Like how can we gather the real information about this?
Okay, so it's like this. You're welcome to follow my Twitter handle. The English word follow doesn't apply to Twitter. Okay, it just means connect. So don't take the literal meaning of follow. It just says you connect to the Twitter handle. So my Twitter handle is dedicated to COVID-19. There is no trash on it. There's no humor. There are no photographs of birds or anything like that on it. So it is purely all the papers that come out, I analyze and I translate into plain English and I put it on Twitter. It's a service. Sometimes I spend, like today, I spent so many hours condensing that because you heard my background. So I'm very well trained in these aspects. So, and I work very hard to keep myself up to date. So I translate all these into short tweets, which are easy for the person to read. So if I spend 2 hours reading a paper, Pawan can read my summary in like 2 seconds and get the same information. So it's a service. So if you're really interested in science, you're welcome to follow the Twitter handle. Just Google my name, Rajiv Jaidevan. It's the same as my Twitter handle. And you asked me how I acquire the information I have. For one thing, to speak about the pandemic or to understand the pandemic is not like knowing about myocardial infarction or knowing about, say, peptic ulcer disease, which is my area. Pandemic encompasses around 15 subjects, like passing SSLC. You got to know your epidemiology, you got to know your genetics, virology, immunology, you got to know communication, medical ethics, pharmacology. Then you got to know your critical care, pulmonology, hematology, and then you got to know a little bit of culture. And then you got to know physics and engineering very well. You got to be very, very good at physics and engineering to be able to figure it out. So all of these things combined, along with a good dose of medical ethics and communication, only then you're able to find it. Otherwise, if you're weak in any of these sections, you get misled by somebody's writing. So I have the ability to find the truth from data. I know a trash paper when I see it, which somebody else might not be able to see. So the trash I throw. That's why I said, you don't listen to stuff that is too good to be true. And then I get my truth by independent sources. I network with people all over the world. There are good people who work for it, and also in India and in Kerala. So I have a finger on the pulse. So otherwise, if you go by just what media tell you or what the government tells you, your views will be skewed by somebody else. So over the year, I've acquired a very strong network of people who I work with all around the world. So I'm updated of the truth at any point. So, but it takes a lot of work. It takes a very, very, very extraordinary amount of work. But thank you for asking.
Doc, one question I would like to ask is, what is your take on the reinfection among vaccinated professionals?
Okay, yeah, very good question. See, vaccines give you 2 levels of protection. The so-called 60 to 90% protection refers to whether the virus gets into you or not. See, virus getting in is not the same as COVID-19. So this efficacy, the published efficacy is simply whether this virus will get inside you or not. That is whether you have neutralizing antibodies or not. If I have neutralizing antibodies, even if I walk into a room with aerosol, I will not get infected. But not everybody with who's been vaccinated, about 10 to 30% people may not have sufficient neutralizing antibodies to stop the virus. But vaccines, they give you polyclonal immunity, which means all your immune arms, like the Army, Navy, and the Air Force, they're all active against the virus. So even if the virus gets inside you, it will not cause serious damage to your systems. And that is primarily by your adaptive immunity or your T cells. So I tweet a lot about T cells, how they work and all that. You're welcome to just go through my Twitter feed. I know it takes a very long time to explain the intricacies of immunology here, but very basically I'll say this. If the virus is a mango tree, and the mangoes are what is called the epitopes. When you're a kid, we all threw stones at mangoes, right? So if the kids are the immune system and we want to attack the virus, there are certain focal points of the virus that are called epitopes. And it is these epitopes that are the targets for our immune system. And our immune system, as I said, is multi-pronged. Antibodies are there, B cells are there, T cells are there, natural killer cells are there, and then so many other like training cells. They all are looking at the mangoes. These variants that come, they don't really alter these epitopes much. So if there are 50 mangoes, only 3 are rotten. So there are still 47 mangoes for us to aim at. So vaccines will work. They will protect you against severe disease. And of course, you will always come across the exceptions. Remember when vaccines first came out, you heard, oh, so-and-so died and all that. But now we know that it really doesn't happen. Same way, you will hear about somebody who's been vaccinated and had severe outcome. You know what? Those are the exceptions. But I'll leave with one last sentence that my cardiology colleague and classmate Anand Janraj told me. He said, exceptions do not define reality. We always read the exceptions. The flight crashes, we read about the flight crashes. But who talks, does anyone talk about the flights that take off and land safely, millions of flights every day? No. One flight crashes, everybody's talking about it. Same way, when vaccine, fails in one doctor or one patient and death occurs, we make a big hue and cry about it. But there are crores of people who are remaining safe after receiving vaccines. So I hope that answers your question.
Yeah, thank you.
You're welcome.
Thank you, Dr. Rajiv, for spending time with us to clear our doubts. It was very helpful for us.
Thank you so much. All right.
Thank you. As professionals to know more about the COVID infection, second infection. And IDA Kerala State appreciates your service to the humanity. Thank you very much, sir.
Thank you. Thank you, sir.
Yeah. Our next speaker for the day is Dr. Pavan Madhusudanan. Dr. Pavan Madhusudanan is a pediatrician working in Government General Hospital, Trichur. He is a nodal officer for COVID vaccination and state action convener of IMA Kerala and is secretary of IMA Trichur. Over to you, Dr. Pavan, for your lecture.
Yes, thank you, Dr. Faisal. And good evening once again to all the participants. And I thank the IDA state officials, especially the IDA office bearers of the academic wing, Dr. Faisal, who is the chairperson of the CDE. And also I extend my thanks to Dr. Rajiv for that wonderful talk. You all might be knowing him already, like he is an excellent speaker and he already gave a very extensive, detailed talk on most of the aspects of COVID. So definitely in this session, he is the star of the day. He has given an excellent talk, but I would like to add on a few more things to what he has already spoken, which is of quite important regarding the daily day and regarding your daily day practice. So, and also I would like to update on the present situation here in Kerala, in most of the districts. Presently, I'm talking from Thrissur. I think the situation in all the districts will be almost same regarding the COVID-19 pandemic situation. So just going to the talk, I'm not going to make any PowerPoint presentation or anything. I'll be just talking for another 10 more minutes. just I'll be dealing with some practical aspects regarding the COVID scenario. Anyway, before that, I'd like to share one poster, one picture with you. I'll just start the screen sharing. I think screen sharing has been disabled. Can you please put it on?
Just a minute.
Yeah.
We can try now.
Yeah, sure. So I think the screen is, you can see my screen, right? So this picture, I intend to show this picture itself. Can you see this picture?
Yes.
This poster shows our actor Dhanush. He has been continuously participating in a shoot for 2 days, I think, for 2 movies continuously, and he could get only and from this picture it is quite sure how much ധനുഷിന്റെ ആരാധകർ അല്ലെങ്കിൽ നാട്ടുകാർക്ക് എന്തോരം വിഷമമുണ്ട് ഈ ഒരു കാര്യത്തിൽ നിന്ന് വളരെ വ്യക്തമാണ്. ധനുഷിന് ആകെ 2-3 മണിക്കൂർ മാത്രമേ ഒരു ദിവസം ഉറങ്ങാൻ കിട്ടുന്നുള്ളൂ. But we all know, like, for the hard work he is doing, he's paid maybe like lakhs of rupees for every minute or every hour he's spending behind the cinema shooting. I would like to show this poster also. ഇതും നമ്മളുടെ ഈ പാൻഡമിക് സീസണിൽ വളരെ വൈഡ് ആയിട്ട് സ്പ്രെഡ് ആയിട്ടുള്ള ഒരു പടമാണ്. കോവിഡ് വാരിയേഴ്സ്, ബിഗ് സല്യൂട്ട് ടു ദം. ഇതിനകത്ത് ഡോക്ടറിന്റെ പടമുണ്ട്, പോലീസ് ഉണ്ട്, നേഴ്സ് ഉണ്ട്, എല്ലാവരും ഉണ്ട്. പക്ഷെ ഈ പടത്തിലെ ഏതിലായിരിക്കും കൂടുതൽ ഒരു ഇമ്പാക്ട് ഉണ്ടാക്കിയിട്ടുണ്ടാവും എന്ന് വെച്ചാൽ നമുക്ക് എല്ലാവർക്കും അറിയാം. ആദ്യം കാണിച്ച ധനുഷിന്റെ പടത്തിലായിരിക്കും തീർച്ചയായിട്ടും. ശരിയല്ലേ? കാരണം എല്ലാവർക്കും വിഷമം, ഒരു സിനിമാ നടൻ ഉറങ്ങാതെ സിനിമ ഷൂട്ടിംഗ് ചെയ്യുമ്പോൾ അയാൾ എത്രത്തോളം ദുരിതം അനുഭവിച്ചിട്ടുണ്ടാവും എന്നുള്ളതാണ് എല്ലാവർക്കും മനസ്സിന് വിഷമം ഉണ്ടാക്കുന്ന ഒരു കാര്യം. ഈ രണ്ടാമത് കാണിച്ച ഈ ഡോക്ടേഴ്സിന്റെ അല്ലെങ്കിൽ നഴ്സസിന്റെ ഒക്കെ പോസ്റ്റർ, ഇതില് നമ്മൾ അനുഭവിക്കുന്ന ഒരു ബുദ്ധിമുട്ട് ജനങ്ങളിലേക്ക് എത്രത്തോളം എത്തുന്നു എന്നുള്ളത് ശരിക്കും പറഞ്ഞാൽ നമ്മൾ ആലോചിക്കേണ്ടിയിരിക്കുന്നു. ഇങ്ങനെയൊക്കെ പടങ്ങളും പോസ്റ്റേഴ്സ് ഒക്കെ വാട്സാപ്പിൽ വരുന്നുണ്ടെങ്കിലും ഷെയർ ചെയ്യുന്നുണ്ടെങ്കിലും അതിൽ എത്രത്തോളം ആത്മാർത്ഥതയുണ്ട് എന്നുള്ളതിന്റെ ഒരു തെളിവാണ് ഇപ്പോഴത്തെ ഒരു സെക്കൻഡ് വേവ്. സെക്കൻഡ് വേവ് ഡെഫിനറ്റ്ലി ഇന്നോവേറ്റബിൾ ആയി അത് എന്തായാലും സംഭവിച്ചേനെ. ബട്ട് സെക്കൻഡ് വേവിന്റെ ഒരു ഇന്റൻസിറ്റി അതിനെ ഡിസൈഡ് ചെയ്തത് പൊതുജനങ്ങൾ അല്ലെങ്കിൽ ഇതെല്ലാം ആളുകളെല്ലാം എത്ര കെയർലെസ് ആയിട്ടാണ് ഈ സിറ്റുവേഷൻ ഹാൻഡിൽ ചെയ്തത് എന്നുള്ളതിന്റെ ഒരു വലിയ തെളിവ് തന്നെയാണ്. നമുക്കറിയാം, ഇലക്ഷന് മുമ്പുണ്ടായിരുന്ന ഇലക്ഷൻ പ്രചരണങ്ങൾ അല്ലെങ്കിൽ ആ ഒരു കഴിഞ്ഞ ഒരു വേവിന് ശേഷം ഉണ്ടായിരുന്ന ഒരു ലേസിനെസ്, അതായത് കോവിഡ് പ്രോട്ടോകോൾ പാലിക്കുന്നതിലുള്ള അലംഭാവങ്ങൾ, ഇതെല്ലാം ഒരു സെക്കൻഡ് വേവിന്റെ ഇന്റൻസിറ്റിനെ കാര്യമായിട്ട് ബാധിച്ചിട്ടുള്ള ഒരു കാര്യമാണ്. I'll stop screen sharing for the time being. And so in this background, നമ്മളിപ്പോ പറയുകയാണെങ്കിൽ I would like to take this time to share a few things regarding the SMS protocols. നിങ്ങൾ ക്ലിനിക്കുകളിലും മറ്റും പാലിക്കേണ്ടതായിട്ടുള്ള കുറച്ച് കാര്യങ്ങൾ. I am not elaborating on the usual things what you have been hearing. Then again, the present situation in each of the district regarding the bed status അല്ലെങ്കിൽ the COVID admission, especially നമ്മൾ ഡോക്ടേഴ്സ് തന്നെ ഇൻഫെക്റ്റഡ് ആവുന്നുണ്ട്, നമ്മുടെ റിലേറ്റീവ്സ്, പാരന്റ്സ് അല്ലെങ്കിൽ നമ്മുടെ സ്പൗസേഴ്സ്, അങ്ങനെ പലർക്കും അഡ്മിഷൻസ് കാര്യങ്ങളൊക്കെ വേണ്ടി വരുന്ന സാഹചര്യം വരുന്നുണ്ട്. ബെഡ് ഉണ്ടോ എന്ന് ചോദിച്ചു കഴിഞ്ഞാൽ ബെഡിന്റെ അവൈലബിലിറ്റീസ് ഡിഫിക്കൾട്ട്, വെന്റിലേറ്റർ അവൈലബിലിറ്റീസ് ഡിഫിക്കൾട്ട്, ഇങ്ങനത്തെ സാഹചര്യം നിലനിൽക്കുന്നുണ്ട്. സോ വാട്ട് ഇസ് ദ സിറ്റുവേഷൻ നൗ? അതേപോലെ ഹോസ്പിറ്റൽസിലുള്ള ഓക്സിജൻ സപ്ലൈ, ഇതായിട്ടുള്ള ബന്ധപ്പെട്ട കാര്യങ്ങളെല്ലാം എന്താണ് ഇപ്പൊ സംഭവിച്ചുകൊണ്ടിരിക്കുന്നത്? ഇങ്ങനെയുള്ള കുറച്ച് കാര്യങ്ങളെ കുറിച്ച് എനിക്ക് അറിയാവുന്ന കുറച്ച് കാര്യങ്ങൾ ഷെയർ ചെയ്യാനാണ് ഞാൻ ഉദ്ദേശിക്കുന്നത്. സോ ടു സ്റ്റാർട്ട് വിത്ത് SMS പ്രോട്ടോകോൾസ്, യു ഓൾ നോ ഇൻ ഡീറ്റെയിൽ. പക്ഷെ എങ്കിലും അതിനകത്ത് എനിക്ക് കുറച്ച് കാര്യങ്ങൾ ഒബ്സർവ് ചെയ്തത്, ഈ ഫസ്റ്റ് റൗണ്ട് ഓഫ് കോവിഡിന് ശേഷം വീണ്ടും നമ്മുടെ ക്ലിനിക്സിലെല്ലാം കേസുകളൊക്കെ വന്നു തുടങ്ങിയപ്പോൾ നമ്മൾ അതിനകത്ത് കുറച്ച് പ്രോട്ടോകോൾ അശ്രദ്ധകൾ കാര്യങ്ങളൊക്കെ കാണിച്ചു തുടങ്ങി. കൃത്യം പറഞ്ഞാൽ അതിനകത്ത് ഒരു ഓവർ ക്രൗഡിങ് വന്നു തുടങ്ങി. വെയിറ്റിംഗ് ഏരിയാസിലൊക്കെ ഡെന്റൽ ക്ലിനിക്സ് മാത്രമല്ല, നമ്മുടെ അതർവൈസ് ബാക്കിയുള്ള ക്ലിനിക്സിലെല്ലാം കണ്ടിരുന്ന ഒരു കാര്യം തന്നെയാണ്. ഓവർ ക്രൗഡിങ് വന്നിരുന്നു. നമ്മൾ പ്രോട്ടോകോൾസ് ഒക്കെ ജസ്റ്റ് ഒരു പേരിന് മാത്രമായി മാറി. അതെല്ലാം നമ്മൾ ഒഴിവാക്കേണ്ടതായിരുന്നു. ഇനിയാണെങ്കിലും ഒഴിവാക്കാൻ ശ്രദ്ധിക്കേണ്ട കാര്യങ്ങളാണ്. അതേപോലെ തന്നെ നമുക്ക് ഡോക്ടേഴ്സിന് സിംറ്റമാറ്റിക് ആവുകയാണെങ്കിൽ പ്രോപ്പർ ടെസ്റ്റിംഗ്, വെദർ ബി ഇറ്റ് ആന്റിജൻ ടെസ്റ്റ് ഓർ RT-PCR വാട്ടർ ഇറ്റ് ബി, പ്രോപ്പർ ടെസ്റ്റിംഗിന് വിധേയരാവുക. അതേപോലെ വാക്സിനേഷൻ ഉണ്ടെങ്കിൽ എടുക്കാൻ പെൻഡിങ് ആയിട്ടുള്ള ആളുകളുണ്ടെങ്കിൽ go for vaccination. I know most of you have got vaccination first doses. Many of you are pending second doses vaccination, or maybe your family members are also pending. Vaccination complete ചെയ്യുക. അതേപോലെ തന്നെ വാക്സിനേഷൻ എടുത്തതിന്റെ ഒരു ധൈര്യത്തിൽ, അതായത് ഫസ്റ്റ് ഡോസ് ഓർ ഇവൻ സെക്കൻഡ് ഡോസ് കിട്ടിയിട്ടുള്ള ആളുകൾ ഇനിയിപ്പോ കുഴപ്പം ഉണ്ടാകില്ല എന്നുള്ളൊരു of course vaccine is protective like Dr. Rajiv already mentioned, but still നമ്മൾ അതില് വാക്സിനേഷൻ എടുത്ത ഒരു കംപ്ലീറ്റ് ആയിട്ടുള്ള ധൈര്യത്തിൽ നമ്മൾ SMS പ്രോട്ടോകോൾ പാലിക്കാതിരിക്കുക, അങ്ങനെയുള്ള സാഹചര്യങ്ങളൊക്കെ. ആൻഡ് മോർ ഓവർ ഒരു ടിപ്പിക്കൽ ഡെന്റൽ ക്ലിനിക്കിന്റെ കാര്യം പറഞ്ഞു കഴിഞ്ഞാൽ, ഐ നോ മോസ്റ്റ് ഓഫ് യുവർ ക്ലിനിക്സ്, ഡെന്റൽ ക്ലിനിക്സ് ആർ വെരി പോഷ്, എക്സ്റ്റെൻസീവ്ലി എന്താ പറയാ ഇന്റീരിയർ വർക്ക് എല്ലാം ചെയ്ത വളരെ പോഷ് ആയിട്ടുള്ള ക്ലിനിക്കുകളാണ് മിക്ക ഡെന്റൽ ക്ലിനിക്സ് എല്ലാം. ബട്ട് അൺഫോർച്ചുനേറ്റ്ലി ഐ വുഡ് സേ ദാറ്റ്.
Yeah, sorry to interrupt. There's been a couple of requests asking, can you speak in English, because this is being circulated in other states also. That's why.
All right. I thought it's going only in Kerala, that's why.
Yeah.
So I'll just repeat what I was telling. So coming to the SMS protocols, like we have to follow all the protocols, avoid the overcrowding situation inside a clinic. And like I was telling, the dental clinics in most of the places are very poshly set up ones, with the interiors and all very well done with centralized AC and all that. But unfortunately, it is a very typical scene or a situation where the COVID can spread. So those people running their own private clinics should make sure that there should be adequate ventilation, and changes should be made in the structure to ensure proper ventilation. Even though it is air conditioned, at times you have to open it up. You have to ensure ventilation to prevent the spread of COVID. Like Dr. Rajiv had already said, like an ideal situation or a typical scene where a COVID spread is a closed room, which is air conditioned, with a lot of people talking without a mask. So in a dental clinic where you are doing a lot of aerosol generating procedure, there has to be a lot of caution. You have to deal it with a lot of caution so that the COVID doesn't spread in such a scene. Again, regarding the staff inside a clinic, like the doctors might be taking extreme caution while doing procedures and all, but in most of the cases we have found the COVID was spreading due to the carelessness seen among the staff who are working in the dental clinics. Like in most of the time when they are doing the procedures and all, they will be following all the protocols. But during break time, especially when we did a survey in a private hospital in our town, what we saw was like all the staff were maintaining all the protocols during the routine work. But once they went for a break, or once they went for a break during the lunch time, they were not following any of the protocols. Instead, they were mingling, they were removing their masks, and they were sitting together, sharing food, using the common toilets without any safety measures, and sharing common wash areas, and which resulted in a widespread among the staff in private hospitals. So that is a situation which can be avoided, and we should avoid in the future as well. One more thing I would like to specify, because in many of the doctor families, what we observed was the COVID came not from the hospitals, but instead many doctors or their spouses got infected from the servants visiting their houses. Because the servants, they might be going to multiple flats, maybe in cities like where I'm living, they go to many other apartments, they come to our houses as well, they bring the disease from outside. Because we'll be taking all the precautions in our work area, in our hospitals, but once we are back home, we may not be taking so much of precautions or so much of care, and there are situations where you get infected from your servants or from the workers, from the drivers. So we have to take utmost precautions to prevent such situation. We have to make them aware. We have to make them wear the mask inside the house as well. I know it is a very sensitive issue, because once you tell the servant to do that, from tomorrow onwards, maybe she'll disappear. She'll stop coming to your house. But this is a situation where you have to deal with it very, even though it's a sensitive thing, you have to teach them, you have to make them aware, and you have to you should tell them to cooperate with the situation. So these are some scenarios where we saw the doctors and families getting infected. So like I told, it was mostly from outside the hospital sources where they got infected. So please take care on all those things. Now coming to the bed status and oxygen status and all those things in Kerala. I don't know about the outside states, but in Kerala, I think daily you might have seen in the media, around 35,000 to 40,000 people are getting tested positive on daily basis. So such cases, it is impossible to admit all of them in the hospitals or in the CFLTC. CFLTC means here, it is a first line treatment centers where the cases which are asymptomatic or with mild symptoms, they are admitted and they are taken care of. So it is impossible to admit 40,000 people daily in all the CFLTCs and the hospitals. We will get exhausted. Our resources will get exhausted very fast. So at the time being, we are doing a home monitoring for asymptomatic and very mild cases. Cases on top of that, which require much more attention, they are admitted in the CFLTCs, and moderate to severe cases are taken up in the hospitals. But as you know, the hospital and all those infrastructure are all very much limited in our state. So coming to the beds, like I've been getting regular calls from a lot of people, including our dental colleagues as well, asking for the bed status in most of the hospitals. I got many calls asking for ventilators, asking for high flow nasal cannulas in many hospitals because their fathers got infected, their mother or their spouses. So it was a very sad situation because we could only give a limited help in such a scene when most of the people, when the hospitals are getting full day by day. So at present in Kerala, what we are doing, in each of the district, there will be a unit under the district collector which coordinates this bed. In Kerala, we have asked all the private hospitals to keep aside 50% of their total bed strength for COVID care. For example, if a hospital is having around 100 beds, 50 beds has to be set aside for COVID care. And out of this 50 beds, 25 beds will be under the control of the government. And the government decides who will get admitted in those 25 beds, or 25% of the total bed strength will be under the government control, and the treatment cost will be decided by the government. In the sense, government will be paying for those patients through the government insurance policy. So all the private hospitals here are requested to do this, and also to get registered in the government insurance program so that they can take up those government cases as well. And coming to the next 25% cases of beds where the COVID cases from the general population, other than from the government sector, when the general public can directly go and get admitted in a hospital, you know, that quota of the bed is also getting exhausted daily. And a lot of people are waiting for the time being in their houses, waiting for ventilators, waiting for other oxygen measures, and waiting for oxygen beds in our places. So this is a very sad situation, and we are expecting much more cases, the number of cases to go up in the coming days. And probably because of the lockdown, it might come down in another week or so, but maybe for another few more days, we are expecting a surge in the cases, and we want to arrange, we are planning and we are doing everything to arrange more number of beds and other resources for such cases. Then coming to the staff in the hospitals, most of the staffs are getting positive, especially in the private hospital. They will be having a fixed number of staff. And in this scenario, if the staff is getting positive because they are not taking adequate precautions, or maybe they are getting overexposed to the COVID scenes, they are going on rest or they are going on treatment. So definitely there is a acute staff shortage in most of the hospitals, including in the doctors pool as well as in the staff nurses pool. And that is also a big issue here. And in such a scenario, when there is a staff shortage in a hospital and the people want to get admitted, you cannot expect a normal scene when one nurse takes care of 6 patients. Ideally, the ratio in a private hospital will be like 1:6 in a normal ward, and maybe 1:3 in an ICU, or 1:1 in a ventilated case. But in such a scene, when the staffs are on shortage, one staff, instead of taking care of 6 patients, they will have to take care of 12 patients or maybe 15. Especially in government scenario, if you ask me, one staff will be taking care of more than 20 cases at a time because our resources are limited. Same is the case with oxygen as well. Most of the oxygen plants here are under the control of the district collector in each district, and he's monitoring the supply of oxygen. This was basically done to prevent, in such a scenario when the oxygen is getting depleted, or when the supply is under shortage, it has to be monitored properly so that each hospital gets its quota correctly. Or else there is a chance for, one hospital can take up all the oxygen or majority of the oxygen supply, and other hospitals can go on a shortage, which can result in the collapse of the system. So because of this, all the oxygen plants in each district is being controlled by the district administration, and each hospital is being given their daily quota according to the number of patients that is getting admitted in each hospital. For example, suppose a private hospital is having 25 beds, and so many patients are, say, like 10 patients are getting oxygen treatment in their beds. The daily quota for the oxygen will be calculated, and that will be requested to the district collector, and he will give approval. In the sense, his unit will give approval for the same, and the hospital gets the oxygen, and that is how oxygen is being supplied here in Kerala. Definitely, there is no lag in the oxygen manufacturing process, or there is no shortage, but definitely there is a lot of logistic issues that is going on, because the oxygen from the plant has to be carried by the hospital in their vehicle. The cylinders has to be picked up from the plants and brought to the hospitals for the steps. So that is definitely creating a lot of confusion and a lot of logistic issues, which is being dealt with, and a lot of people are behind this for settling these issues. So in this background, you can just imagine if one of us are getting infected, and or our family members, they are getting infected, what is to be done? So actually the state is planning for a contingency plan, like if the cases go up and if the patients are not able to procure beds in the hospital. Like for the past 2-3 weeks, what we saw was most of the patients, even during their initial phase of the illness, even if they were asymptomatic, most of the influential people, what they used to do was they used to get a bed in the private hospital by influencing somebody. They'll get admitted, and probably even if they didn't have any issues, they will consume that bed for another week or so, or maybe more than that. But what happened was, like, so the real patient or the real case which required a critical bed was denied, because people were unnecessarily getting admitted in the hospital. But now we are trying to control it by strict monitoring, and what we plan to do is, like, such cases has to be definitely treated in a hospital inside our houses itself, but they will be monitored by the government and the government agencies. They will take care of the patients. They will be doing teleconsultations, or they will be health team will be visiting their houses, and they will be taking a survey of the cases, and they will see how well they are doing, so that if they need to be shifted to the hospital, they will be shifted. But otherwise, if they are asymptomatic and they are not so sick, they can manage in their houses itself. So that will help in effectively managing our resources in this shortage. And as you all know, the patient has been divided into category A, B, C, and all. That is purely for logistic purposes. But as far as we are concerned, we are, as far as the doctors community is concerned, we are seeing if the patient is sick or not. Basically, if it is a mild case, is it a moderate case, or is it a severe case? Definitely severe cases needs to be hospitalized. Moderate cases up to a certain extent can be managed in their houses, and mild cases definitely they can manage in their houses, but monitor for worsening. And if they are worsening, they have to be shifted to the hospital according to the availability of the bed. But like I said, since there is shortage of the bed, we are looking for a contingency plan where the patients can be kept inside their homes, and to a certain extent, where the moderate cases can also be managed inside a house under the strict monitoring of a doctor. The doctor may not be physically present there, but he will be consulting through the phone, through video calls, or maybe the health team will be visiting your houses. So my question, or the point we have to discuss here is, what can dental surgeons, how can they involve in such a situation? What role do they play in such a situation? Definitely, like I said, when we are going for more home monitoring situation, you definitely have a big role to play, because be it inside your family or be it in your neighborhood, you can do a lot of preliminary or primary care in your area. What you can do is you can monitor those cases, you can keep a follow-up on those cases, see for their symptoms, see for the worsening of the symptoms, and you may opt, or you may request the authorities to do a referral in case they need higher care. So how do you monitor a patient? That is the point which we have to discuss on. I don't want to talk extensively on that, because I'm pretty sure most of you might be knowing all the details, but I'd like to just pick out a few points. Like, so why do we need monitoring? We can do the monitoring. If they are asymptomatic, you may also play a role in managing those cases by giving baseline medicines. And even mild to moderate cases, you may be able to manage them inside their houses. But how? So by monitoring their basic vitals, for example, you have to daily monitor such cases. Suppose, for example, your neighbor is getting the COVID infection and he's not able to procure a bed, but he's calling you, you being his friend, he's calling you and asking for help and asking for the symptoms regarding the COVID and asking him to help him out. Maybe you can do a video call and you can assess him. What you have to ask is about his pulse oximeter reading. See, when we are keeping a patient inside a home quarantine or under a home care, we cannot imagine a situation where we are not managing without a pulse oximeter in an ideal setting. So definitely such patients should be advised to get a pulse oximeter if possible. There are other ways to monitor breathing pattern also, but still we prefer to use a pulse oximetry and see for the saturation levels. You know, the pulse oximeter has to be ideally kept in the middle finger and you have to take the reading. And in such a situation, you have to see if the oxygen saturation is more than 94 or not. And ask him for the respiratory rate. If you are able to visualize, see for the respiratory rate or chest rise. If it is more than 30, that means he's going into severe condition. Even if it is more than 24, maybe he's going into severe to moderate category. And if it is less than that, he's probably in a safer zone. And if the pulse ox, just like that, if the pulse ox is more than 94, he is in a safe zone. If it is between 90 to 94, he should be, monitored much more frequently. And if it is going less than 90, below 90, you have to definitely think about shifting him to your hospital. And other red flag signs which you have to monitor for is persisting fever. Definitely you will be having fever initial 2-3 days. But if the fever is persisting for more than 5 days, 6 days like that, or if he's having some features like altered sensorium, or if he's having any chest pain or excessive fatigability, which is a very important sign when the patient is being monitored inside a house. Because most of the patients, when they get a viral illness, they will say they are having fatigue. But in this COVID scene, when you are having hypoxic cases, hypoxia may not manifest otherwise, but they might manifest by this excessive fatigability. The patient will be having very difficulty in speaking. They will say that they are feeling exhausted when they go to the toilet or when they stand and walk for some time. And there is another test known as 6-minute walking test. Or maybe you can ask the patient to take something like 30 to 40 steps inside his room. And if he's going breathless, definitely that is a sign of hypoxia. And you should think about shifting him to the hospital. And again, ask him for his urine output, see for his peripheries. If it is cold, clammy, like if his relatives are complaining like his peripheries are very cold and clammy, something like that, that also shows poor perfusion, inadequate perfusion status. You should shift him to a hospital. So in short, like what I meant to say was, if you find any signs of hypoxia or any signs of breathlessness in a patient, you should think of shifting him to a hospital. But before that, don't shift unnecessarily to a hospital so that a real case is not denied a treatment there, because a case seemingly well, which do not need much intervention, should not be admitted unnecessarily in a hospital. Also, you can plan of starting few drugs inside a home setting itself. Like I said, you did not get a bed, but you see the patient is in the moderate to severe category or mild to moderate category, and you wish to start few treatment for the patient. Definitely, you can go for starting antipyretics like paracetamol. And if you ask me about the vitamins like zinc, vitamin C and all, there is nothing wrong in giving it, but the evidence show it doesn't work much. So I would like to point out one more thing. The major issue in our policy is because of the polypharmacy, because a lot of medicines are being included in the you can see a lot of prescriptions going on widely circulated in the WhatsApp that is showing azithromycin, vitamin C, vitamin zinc, paracetamol and hydroxychloroquine, etc. A lot of other medications are being written unnecessarily. You get it through the WhatsApp and you buy that, but it's absolute rubbish. Because like Dr. Rajiv already mentioned, like for a mild disease, there is absolutely no role in major treatment there. Just the patient has to be monitored. But if he's having fever, treat the symptomatic issues like fever. You can give paracetamol. Do not give azithromycin. It's an antibiotic. Do not give it unnecessarily in a viral infection, because azithromycin was used as an immunomodulator initially in the past protocols, but clearly we have avoided it in the recent protocols. Coming to the Kerala treatment protocol, which is quite similar to the AIMS protocol. It includes ivermectin. Dr. Rajiv was telling that ivermectin is quite useless, but here I am telling about the Kerala State Health protocol, COVID protocol, which includes ivermectin. But definitely it's not a wonder drug. I would call a steroid as a wonder drug in case of a COVID. But steroid is a drug which you have to use with lot of caution. It's a double-edged sword. You should not use steroid in the early phase of the disease. That is during the viremic phase. If you use steroid unnecessarily, you will land up in complications. But steroid has to be used judiciously in certain period, like when you see the fever is persisting more than 5 days and your body is going into a hyperinflammatory state, and you see certain lab investigations like D-dimers, your CRP, etc., going up, you can opt for starting steroid. Steroid may not be started ideally in a hospital setting. Maybe you can opt for giving oral steroid drugs in such a situation in a home. For example, you can use oral dexamethasone, or you can give methylprednisolone tablets, or even our normal prednisolone tablets can be used in such a situation because the patient could not be admitted in a hospital. Similarly, you can also use inhaled steroids like budesonide. Budesonide can be used as per our protocol. Budesonide 800 microgram inhalers can be used in such a setting. But again, I would like to remind you that it should not be used unnecessarily in all the cases. Why I'm telling this is because when such things are explained, there is a tendency for people to go and accumulate all these medicines, go and buy, a couple of inhalers, go buy a lot of dexamethasone tablets, go buy a lot of paracetamol, azithromycin and all. So that should not be done unnecessarily. Everything has to be done judiciously, and only those who require such medicines should be treated. Because if you are giving unnecessary treatment at some wrong point of the disease without knowing the pathology of the disease, you'll end up in trouble. So this is in short, like what I wanted to mention about the role of the dental surgeons in the community in this COVID scenario. And I would like to say one more thing. If you all are interested in going through the protocol, we can keep another session for detailing, for explaining more on the COVID treatment plans and protocols, which requires much more time. Maybe we'll take around 2 to 3 hours, because it requires much more explanation regarding the pathophysiology of the disease. And you should know why we are using so and so drugs in this point of time. So it requires much more time. And if you all are willing, probably IMA can arrange a session for our IDA colleagues to explain more on the treatment protocols, so you can more effectively manage such cases inside the home atmosphere itself. Instead of admitting a lot of cases in the hospital, you can manage it inside your houses. So with these words, I would like to conclude, and I would like to hand over to Dr. Faisal.
Thank you, Doctor, for a nice lecture. A lot of questions come up. I'll just go through the questions. Meanwhile, Dr. Shibu.
Yeah.
For your remarks, Dr. Shibu.
Yeah. Respected President, Dr. Joseph C.C., Secretary, Dr. Deepu Matthew, and CD Chairman, Dr. Faisal C.P. It was a very informative interaction. Thanks to Dr. Rajiv and Dr. Pawan. Kudos to CD wing headed by Dr. Faisal to bringing such a meaningful CD in this alarming situation. Service to humanity, service to God, and we as a professional organization, IDEA is very active in COVID-related services. We were in the forefront in taking the straps and all, and even before the vaccination process was started. In future, if situation demands, like Dr. Pawan said, in case of a contingency, our members will be, I'm sure, will be ready to be in the forefront. Our services can be rendered in the FLTCs and all. For that, proper training will be needed, and this CD definitely throws light in that direction also. Thanks to the faculty and thanks to the CD wing for such a wonderful and meaningful interaction. Thank you. Thank you.
Thank you, Dr. Shibu. There are some questions come up.
Before
First
that,
question.
can I add one more thing?
Yeah, sure.
Like I already mentioned, a lot of dental surgeons have been trained already, and they have been included in the treating teams already. Like they can register their names in the COVID brigade. I'm talking about the situation in Kerala for the outside audience. Like they can register their names in the COVID brigade, and their names will be sent to each district, and they'll be included in the district treating teams, and they'll be posted in CFLTCs and treating centers where they'll be assisting the main physician, and they are actually playing a big role in the treatment when we are having a lot of deficiency in the doctor's pool. So even now the registration is being entertained. You can register your names, and you will be prioritized, like on first come first serve basis. They are allotting people. Right now most of the places are full, I think, but very soon, if the cases are going up, we'll need more number of people. So definitely your names will be included. Those who haven't registered yet, I request you to register your names in the COVID brigade, which comes under the COVID Jagrada portal in Kerala.
Doctor, we have some questions come up. The first question is about the fungal infection, mucormycosis after the COVID. How serious it is, and what is the medication, and how long it can affect the person?
Yeah, mucormycosis, people have started talking about this very recently. Like it has been found to be a major issue in the post-COVID scene when immunocompromised patients, like those, for example, a diabetic case, he has been treated for the COVID in the ICU for a prolonged time. He was ventilated. In such a scenario, you expect the patient to be to continue in a immunocompromised state, because he would have already received a lot of immunosuppressant drugs in the ICU, like in the case of use of steroids and all. So what they can manifest is like they can present with severe headache, probably with epistaxis, then like with the pain in the eyeball, like bulging of the eyeball. It can manifest in a lot of other ways as well. It is considered as a very serious issue and as a very serious complication of COVID illness, or rather as a complication of post-COVID treatment scenario. Like in such cases, high-risk patients have to be monitored properly. They have to, you have to watch them for development of such symptoms, and definitely if they are having the above mentioned symptoms, they have to seek a medical attention.
Doctor, what is the role of chlorhexidine and hydrogen peroxide mouthwashes nowadays? I mean, for patients before doing the dental treatment. What is the role of chlorhexidine and hydrogen peroxide mouthwash? Gargling.
Yeah,
before doing
gargling,
dental treatment.
definitely gargling as a part of personal hygiene. It's very important. But if you ask me the role of specific agents in that, I'm not pretty sure about it, because there are various lines of thinking on this issue. Like many people have told that like this iodine gargle and the similar things have been proved to be very efficient. But there are other studies as well which shows that it is not so quite useless. Like Rajiv already said, like there are using the UV rays for disinfecting the personal equipments and all. This also has two lines of thinking. Like some say that it is useful, but definitely as a part of personal hygiene, I would request, if any one of you wishes to do that, there is nothing wrong in doing that. Same thing I would like to add on steam inhalation, because if you ask the scientific basis of doing it, like we may not be able to promote it. But in other aspect, if you say, like if you ask me, like for a patient with a viral disease or a viral illness, viral URI, if they take a steam inhalation, it is if it proves to be something which gives a symptomatic relief, there is nothing wrong in doing it. Just like taking vitamin C tablets or taking zinc tablets, there is nothing wrong. It's not going to cause any damage. But if it's its efficacy have to be proved scientifically.
Doctor, as a healthcare person, are you expecting a third wave, or do you think that children will be affected with the third wave?
Definitely, third wave will be there, but it depends depends like how intense it's going to be. Like second wave also we expect
Any special precautions to be taken, doctor?
Yeah, I'll tell you. So very frankly, we expected the second wave, but not so fast and not so severe. That's the truth. That was quite evident if you look at the previous months, like in January, February, and all. We were all quite relaxed. We were not used, like vaccines also came in between. We all were quite confident, like we are going to tackle this very, in a very superb manner. But this was quite unexpected. It came very fast, and like within a week, you saw the hospitals getting full and all the beds getting, and people are running around for ventilators and all. That was quite fast. If you ask me why that happened, that is definitely because, like I already mentioned in this beginning, the start of my talk, that was because of the, because people were not sticking to the protocols properly. Same thing will happen in the third wave and the fourth wave. We are, like in any pandemic, we are expecting a third and a fourth wave. If you ask me how people are going to get infected in this, especially if you ask me, are children going to get infected? Definitely children will be infected. But now a lot of news is spreading like children will be more affected, and you are going to see number of deaths in children in the third wave. That is basically an assumption. Like in this wave, you saw a lot of younger people, like between the age group of 30 to 40 on the ventilators are dying. And the explanation given to that is like the above 60 people, most of them got vaccinated. Now the 30 to 40 or 20 to 50 age group people, they are not so well vaccinated, so they are getting the infection. Now, as soon as they are going to get vaccinated in the third wave, there will be a shift in the age group. Like it is going to more affect the pediatric age group. Definitely pediatric age group will be affected, but right now we don't have any evidence to say that it will be very severe, and it is going to create a lot of, it is not going to result in more number of death in the pediatric scenario. Pediatric deaths are happening even now. It has happened in the previous wave itself, but the same thing will happen in the third wave also. But now we don't have data to say that there'll be more number of death compared to the present situation. Even I've heard officials from other states declaring the same thing, like there'll be more pediatric emergencies and pediatric death in the third wave. But there are other authorities which have, given a clarification like what I have said.
Faisalji?
I think there is some issue with the transmission.
Yeah. Dr. Faisal? Yeah, I think it's.
I've been made the host now. Yeah.
I know. He'll just get connected back.
Yeah. I think there's some connectivity issue.
Generally, what do you think, Doctor, is going to be? Now, a flash news, the lockdown has been extended till May 23rd is what I was just watching. I got a message just now. So what do you think is going to be the general outcome?
Definitely, lockdown will bring the number of cases down. It is going to crush the wave, but it will take its own time. Like what we are seeing right now is the effect of, previous month activities. Like we had the pre-election campaigning and all those things which have triggered the situation, and we saw other things as well. We are seeing the after effects of all that. Now we are waiting for the after effects of or rather the result of the lockdown. It will take maybe another couple of weeks to settle things out. Like since we are having almost like 2 weeks lockdown, probably in another maybe like 2 or 3 weeks time, things will settle down. But that 2 weeks, the coming 2 weeks time is very crucial, because that depends, that will decide the fate of the present wave.
Doctor, another question is, if any of our colleagues get infected, or people who are working in our clinic get, hello? Can you hear me?
Can you be a little more louder, please? Yes.
If any of our colleagues get infected with the virus or
Yes.
COVID virus, what precaution should we take in those cases?
Positive.
People working with us in the clinic, if they get infected.
In the clinic, definitely, if you're getting infected inside the clinic, you should ask your colleagues who was working with you to go on quarantine. And if they develop symptoms, they should be asked to do the testing. And once you are infected, you're going back to your family. So keep a watch on that. You should definitely take all the precautions. If your house is a double-storied house, definitely you should shift to the upper story. You should live there, taking all the maintaining all the protocols. You should have a system for food supply, washing your clothes, and all that. You should not mingle with your family, and you should not allow your family members to get infected. And at the same time, I would advise you to keep a contact with your other doctor colleagues as well, because in case of an emergency, if you want to clarify something, you should have a contact with them, which would prove to be quite helpful when they can handle the situation through phone. Maybe they can advise you something through phone. And especially in such a scenario, the mental health also is very, very important. You can what you see in this usual now in this situation is when a patient is admitted in ICU, even if his mental status was quite normal before the illness, once he's admitted in the ICU, he's going to see a lot of death. Probably the patient lying next to him is going to die the next day. Probably he's going to be ventilated. He'll be facing a lot of anxiety, and he'll be undergoing a lot of mental stress, mental trauma, and that can result in a post-traumatic stress disorder kind of thing as well, once he recovers also. So that requires a lot of mental support. So maintaining a normal mental health status, very healthy status, keeping jovial yourself is also very important once you are infected, because you should not lose hope. Like we already said, majority of the cases, nothing is going to happen. Only a few number of cases, maybe like 10% is going into complication. Just because the number of cases, the number of infected cases are going up, like 40,000 people are getting infected daily. So out of that, the percentage of complications will also be higher. That is because the number of cases testing positive is going up. That is the reason for more number of complicated cases as well. But once we are able to bring it down, the complicated cases will also go down. So that means only a very minority of the cases is going into complication, which will need ICU care, which will need ventilation and all those things. So basically, you have to keep a good mental status during the COVID period, more than anything else, I would say.
What about the children under 18? What about the vaccination for them?
Yeah, vaccination, it is under trial. Very soon, I think they'll be planning on starting the vaccination for the under 18 children as well. So in the same time also, especially for the children, this is going to be a very sensitive issue. A lot of people are going to come up asking for the safety regarding the vaccines, if it is safe to give it to the children or not, and which brand to use, whether they should give Covaxin, whether they should use Covishield and all. But once I think the Covaxin trial is going on, or they have called for a trial right now. And once it is out, and once it is proven to be safe, all the children should start undergoing vaccination as per the availability. And I'm pretty sure that it is going to be safe as well, because as you know, in pregnant women and lactating ladies, the vaccination was withheld previously, but now it is proven to be quite safe, and we are going to start it very soon as well.
Sir, is the protocol same for treatment of children?
Protocol is quite different for treatment of children, because like I mentioned, ivermectin, it's not used in children, and steroids, it is used with caution in children, and number of children going into complications, it will be much lesser compared to adults. So there are quite differences in both the protocols for pediatric as well as for the adults. Definitely inhalers like budesonide can be used in children and adults as well, but certain drugs like ivermectin and other drugs will not be used it's not used in children, and it is not included in the protocol, the state protocol.
Can you add about post-COVID complications, autoimmune diseases after the COVID, like vasculitis?
It is a very extensive topic, which requires a lot of time to be discussed. But briefly mentioning about it, you see a a small percentage of cases going for complication. Like the same question has been asked regarding vaccination as well. You are like a lot of people asked, like the people who took vaccines, they had a concern if they were going into vascularity complications and other thrombotic complications, etc., etc. Same thing is happening with the COVID disease as well. Like you expect a lot of complications, but those who are properly treated with proper drugs, which is started at the right time, like I said, drugs like steroids, drugs like heparin, low molecular weight heparin or anticoagulant agents, they have to be started at the correct point of time in treating the disease. For example, if you have to start this drug on day 5 or on day 6, or when the patient is showing this type of symptom, it has to be started immediately. Instead of that, if you are postponing, or by chance if you are not admitted in the hospital and the treatment was postponed, that in such scenarios the patients may go or may develop such complications in the coming days. Or and in some other cases, in very few minority of the cases, even if they were given all the treatment privileges and all, they are also found to be developing this vascularity complications, but it is very negligible amount of people, I should say. And also asking about autoimmune diseases and all, like there are many situations when people are saying like they were not diabetic previously, but after this treatment, or maybe after getting infected with COVID, you are seeing a lot of people developing diabetes. But all those needs more evaluation and more studies, because you require more data to comment on such things.
So what's the role of fumigation? Do you advise fumigation in the clinics?
Fumigation, to be frank, all of us are doing, like we are fumigating the hospitals, clinics and all. But again, I would like to quote Dr. Rajiv's words, like I don't know how effective it is going to be, because depends on the solution you are. But I can definitely say, like once you are cleaning your clinic with just base sodium hypochlorite solution, just 1% sodium, this bleaching solution, it is going to be effective. And you may clean your instruments. Delicate instruments may not be cleaned with this bleaching solution. It can be cleaned with spirit. There is nothing harming. Maybe it is proven to be efficient. But regarding fumigating, you may do it. There is nothing harm in doing it, but its efficacy is questionable, because there are a lot of fumigating machines, lot of liquids for use for fumigation, multiple types of things. Its efficacy is questionable.
Dr. Deepu, you want to ask any question, Dr. Deepu?
Yeah, I just saw
anybody in the panel.
Yeah, in the chat box, I saw a question. How can you vaccinate a 90-year-old lady who's anemic?
90-year-old lady who is anemic.
Yeah.
So adding few more words on vaccination, like when the vaccination started, there were a lot of queries regarding such things. Like many people, the most common question which we faced was a person X who is allergic to penicillin, or maybe allergic to multiple drugs, whether he could be vaccinated. That was a very relevant question, because even in the the notes which came with the vaccine, it mentioned it has to be avoided in case of a allergy, or a person who is allergic to medicines and all the stuff. But what we found initially, we postponed such events, but later on we found that it did not create much of an issue. So we slowly started vaccinating people who were allergic to penicillin, or who were allergic to sulfa and many other drugs. But we, as far as I know, in our data, we didn't have any atrocities. We didn't have any adverse effects following immunization. And it was quite, I received a lot of calls from other hospitals asking if they can vaccinate such people. What I usually say is, like, it is contraindicated as per the vaccine companies, but according to our data, or according to our situation, we have vaccinated a lot of people, and we didn't have any major issues following vaccination. Probably such a person may collapse following vaccination, because maybe due to the pain or something like that, but we didn't have any issue like major allergic or anaphylactic issues following vaccination. Same thing with this anemia. If you ask me, there is nothing wrong in vaccinating a patient who is anemic. probably he has to be vaccinated because maybe he's prone to, develop more further disease, or maybe his immunostatus has to be ensured, whether it is reliable or whether it is in a good condition to prevent the disease. Again, if you ask me if we can vaccinate in a immunocompromised patient, like a patient undergoing cancer therapy or such cases, definitely they can be vaccinated. But I would suggest to take an opinion from their oncologist as well, because in certain type of cancers or in certain cancer treatments, definitely with the blood counts, the white cells and all, there is a tendency for that to go down. So in that case, if you take a vaccine, it may not be so, it may not show its full efficacy or may not show its full potency. So in such cases, we tend to postpone it.
So there's one question
and
about
one
the
more thing
vaccination.
about anemic, because you asked me, there is a chance for thrombotic complication, very rare chance for thrombotic complication. So I wouldn't say just go blindly and do the vaccination in such a case, but only after proper examination by a physician, and she should get a, so certain things, if you ask me over phone, I can just say a positive answer, but some things it has to be consulted by their family physician and ensure there is nothing which prevents her from getting vaccinated.
Yeah, thank you.
There's a question about vaccination. After contacting COVID, how many days after COVID can a person go for vaccination?
Yeah, that's a very common question. Like post-COVID, initially what we told them was to take the vaccine after 28 days. So those who tested negative, from that day onwards, we used to give them after 28 days of turning negative after the infection. But actually, there are studies which show it is better to give it after 3 months, and there are other studies which show it is good to give after 6 months, because naturally they will be having they will be developing immunity against the pathogen, definitely for a quite longer time. Like what we used to think was like they should be vaccinated after 1 month, but instead of that, I would say it is better to vaccinate after 3 months, or there are in ideal situation, even if you postpone it up for 6 months, there is no issue.
Okay.
But
what
then
about the cardiac patients?
But again, in such cases, we have to follow the state protocol. The protocol here says to do it after 28 days. In that case, we have to follow the protocol. There is no issue in postponing it, but the issue will be the availability of vaccine. If you postpone it for another 3 months and wait for the vaccine, and at that point, if you are not able to procure the vaccine, that will be an issue. Because same thing, if you ask me, like when the Covishield, which we took, I was one among the first who took the vaccine in the first round itself. So at that point, we had a lot of studies which said the second dose is ideally to be taken after 12 weeks, something like that. But then the state protocol said to take it after 28 days. I thought of postponing it, but then I had a second thought. If by end of the 12 weeks, if there is vaccine deficiency, I'm not going to get the second dose. So I just followed the state protocol.
So what about the vaccination in elderly who got a cardiac disease or cardiac issues?
No issue in taking vaccination. In such cases, we have to seek the risk versus benefit assessment. So if his physician says that it is better to get vaccinated such a patient, then you should go for vaccination. But absolutely, there is no contraindication for vaccinating cardiac cases.
Doctor, if a patient gets a non-patient gets infected, what's the role of D-dimer 6 LK6 ferritin and CRP test on those patients? They are under home isolation.
I would say that this is the most important question which I've received till now from this session, and it needs a lot of explanation. But I would like to, explain it in very brief words, that those are the things which decide whether the patient has to be hospitalized and should be given higher treatment, whether the patient has to be administered drugs like steroids or other immunomodulated drugs. That is the point where you decide whether the patient has to be given anticoagulant drugs. So basically, in a patient, in a case when you are suspecting hypoxia, and if you are suspecting further worsening or expecting any complication, you have to do this investigations like D-dimers, CRP level. There are certain cutoff factors depending on the age group and all. But then if the these are called the inflammatory markers, and definitely if those inflammatory markers are elevated, or if they are showing in a very alarming sign, they should be intervened immediately. They should be started on certain drugs like steroids, IV steroids, or like immunomodulated drugs, or other oxygen parameters should be monitored and should be started on oxygen therapy, and further decision has to be taken.
Doctor, regarding one more question regarding the vaccination. If a person gets infected after the first dose of vaccine, how long should we wait for the second dose to be taken?
Again, that depends on the state protocol. Like I have already mentioned, like we were waiting for 28 days to be completed for the second dose. Then they said that it can be taken after 42 days. Now there is a plan to extend it till 12 weeks. Like I already mentioned, initially itself, we had data which showed the ideal situation would be first dose and the second dose after 12 weeks. But the state protocol was to take it after 28 days. But presently, the new protocol says it has to be taken after 12 weeks. But some people are commenting on the protocol saying that it has been extended because of the deficiency of the vaccine supply. But I would not like to take a statement like that. It is definitely because studies prove that it is best to be taken after 12 weeks.
And doctor, is there a need to check the antibody titer, especially we healthcare workers frequently? And what's the safe limit?
If you ask me, if I did it, I had to undergo the testing as a part of the survey by the ICMR, and my antibody level was shown to be nil. So I would like to comment that it is absolutely unnecessary to do. I think Dr. Rajiv has already explained on this. It is quite unnecessary and waste of money to do an antibody testing, because there are various factors which decides it. So unnecessarily checking the antibody and deciding on vaccination, or it is absolutely unnecessary.
Doctor, one question is about the hypersensitivity to intravenous dose of MRI. Can a patient who is having hypersensitivity to intravenous dose of MRI undergo vaccine?
That's a difficult question, because I'm not pretty sure about it, but I can say that he can be safely vaccinated, because a lot of people who had allergy to a lot of other drugs, like I already mentioned, like penicillin, sulfas, or any other drug, they were vaccinated and they were found to be safe. So in this case, if you ask me, I don't have a data, like I don't have an experience like anybody asking me such a question. I have not given permission for anybody to take a vaccine in this case, in such a case, but maybe it could be safe. But I would suggest them to wait for a little more time unless we get more data regarding the safety. Again, vaccination in such a case, it can be taken in a very well-equipped center where they have a facility to manage an adverse effect following immunization. If they have all the emergency setup, and if you take a vaccination in such a place, there may not be an issue. Even if you develop anaphylaxis or anything, they will have all the facility to manage. So I would suggest such a patient to go to a well-equipped center to take vaccination. Again, that has to be decided weighing the risk versus benefit factors. If he is a very risky case which has to undergo which he should be vaccinated to prevent from many other atrocities, in that case you should take the risk of vaccinating him in such a scenario.
Dr. Deepu?
Yeah. What was initially planned as a 1-hour program, due to the wonderful deliberations by Dr. Rajiv and Dr. Pawan, has now extended to almost 2 hours. It shows the interest that, and the really shows how effective this program has been. I should extend my heartfelt thanks to both of you. One thing I would like to remind all those who are viewing this is that, like Dr. Pavan was saying, the mental stress levels are high among the whole of society, especially among the dental community, which has been, severely affected for the past 1 year. We're just beginning to get back to half normal when again the second wave has come. So considering all this, IDA Chalakudi on behalf of IDA Kerala State is celebrating International Family Day tomorrow by giving a stress relieving program. And it is Dr. C.V. Pulayat is the speaker. He is a speaker par excellence, a motivator. And I encourage all of those people who are watching this program to please join this program, which is being hosted for IDA Kerala State by IDA Chalakudi. And I'll send the invitation to Dr. Pavan also, so you can just enjoy a few moments of stress-free life maybe. And I like looking at the feedback from the chats and all. We will definitely need a treatment protocol session, which I request at this moment on open forum to Dr. Pavan to please consider, and maybe we can do something. Dr. Faisal, please.
Over to Dr. Joseph for the concluding remarks. A lot of things.
So, Dr. Pavan, it's a wonderful presentation. Actually, it's a real eye-opener for all the members. So, please consider the treatment aspect of the COVID protocol for us one more session. So, thank you, Pavan, for your gracious presence. I would like to thank Dr. Rajiv also. Thank you.
Okay, thank you, Dr. Pavan, for the interesting lecture. There were a lot of questions which was answered very effectively and efficiently. It was a great learning process for all of us. Hope to see you in another session with us very soon. Thank you. I thank all the members who have attended this session and who have asked a lot of questions to clear the doubts. Thank you, one and all.
Yes, thank you once again, and I thank all the officers as well as the audience. And I assure you, we can conduct further sessions on discussing the treatment protocols and discussing more on the pathology of the disease, so that you get well to know more on the disease and the treatment, the management things as well. And I thank everyone once again, and have a nice day. Thank you.
Bye.